So in continuation with our previous lecture, today we'll solve MCQ of pharmacology section. So this MCQ is from general pharmacology, where dose rate is given 2 mg per kg and body weight of calf is 150 kg and marbofloxacin strength is given 10%. So what they have asked is how much ml you will withdraw from this bottle and inject into the calf body. So we'll start the solution for this, means how much ml you will draw from the bottle to inject into the calf. So as we know, first step is to calculate the dose, that is dose rate into body weight. Dose rate is 2 mg per kg into body weight is 50 kg. So that is 300 mg. And what is the concentration in this marbofloxacin bottle? 10% means 10 gram in 100 ml. 10 grams means 1000 mg in 100 ml. So what is the concentration? That is 100 mg per ml. So in 1 ml, 100 mg is present in this bottle. And what is the dose? 300 mg. So if you inject 1 ml, then you are injecting 100 mg. But we need to inject 300 mg. So 3 ml contain 300 mg. So the answer is 3 ml. So from this bottle you will withdraw 3 ml and will inject into the calf. So the answer is 3 ml. Next question is related with Drug and Cosmetic Act 1940. This act, as I explained in my theory lectures, this act was came with the effort of Colonel Ramnath Chopra, that he was the chairman of a drug inquiry committee, and through that efforts and recommendation, this act came in 1962. So 3 MCQs asked in this exam from this topic, Drug and Cosmetic Act. First was simple MCQ, that is which act ensure that drug and cosmetic which are sold in our country India, they are safe, they are effective, and they belongs to quality standard. So the answer will be Drug and Cosmetic Act 1940. The second MCQ asked from this Drug and Cosmetic Act is related with the drug label. So the next MCQ that is related with the drug label. This is the label where they have given one question related with the drug and they have asked this belongs to which schedule of the Drug and Cosmetic Act, H, H1, G or X. So what it written is, it is dangerous to take this preparation except under medical supervision. So such kind of questions they are written on the preparations which comes under schedule G. Then what is written if the drug belongs to H, H1 or X category? In these 3 cases, on the label one warning should be written, but in case of G schedule, what is written? This question should be written, but in case of H, H1, X, one warning is written, and that warning is to be sold by retail on the prescription of a registered medical practitioner only. So if the drug belongs to schedule H, H1 or X, the first condition is the warning. Second is symbol. If the drug belong to X category, means anesthesia, for example, the drug is ketamine, then the symbol would be XRX, that is on the left top corner, and on the left hand side there is one vertical red line, and the width of this red line, it should not be less than 1 mm. So for schedule X drug like ketamine, first there should be warning that sold by registered medical practitioner only, and second is the symbol XRX symbol is written. Okay, if it is a narcotic substance, narcotic or psychotropic drug, for example morphine and tramadol, like opioid, then and in that case first warning should be there, and second is the symbol, and symbol will be your NRX on the left top corner. If it is antibiotic, then on this label warning should be there, and second is the symbol, and symbol is the simple RX. Along with that, this vertical red line whose width should not be less than 1 mm. So H1 category drug, mainly antibiotic. So this schedule H1 is related with the antibiotic, and X for the ketamine anesthesia drugs, and simple H is for the, that is first warning, and RX and vertical red line on the left hand side of the label. If it is written as question, then that belong to schedule G, and warning is written, then that belong to H, H1 or X. Next MCQ is also related with the drug label. There on this label, for example, this is the read, and the composition of read, as you know, it is the amitraz. On the drug label, precaution, caution, warning and contraindication, these are written, and they are asking which is most serious and severe, which of the following is most serious and the most severe. So first is the precaution, for example, avoid from the reach of the children, and caution, warning and contraindication. As we all know, amitraz is contraindicated in case of horse. If we apply this amitraz in case of horses, the horse may die because of the toxicity. So out of these, contraindication is the most serious and most severe, dangerous or threatening for the life of the horse. So to be sold by retail on prescription of registered medical practitioner under medical supervision, out of these, this contraindication is the most serious life threatening condition if you apply the read or amitraz in case of horses. So the answer is the contraindication. This is the most serious on the drug label. Although these all fours are not written on the label, but they are asking if out of these four, which one is most serious one. So contraindication is the serious. So we cannot apply amitraz in case of horses. Similarly, if it is the ivermectin, then what is the contraindication? That we should not inject. Contraindication is, this is contraindicated in horse by IV route or subcutaneous or intramuscular route, because in case of horses, ivermectin is given by the oral route only, that is the recommended route. So that is contraindication is the most serious and life-threatening in this case. Next MCQ is, which of the following bench-imidazole is safe in pregnancy? And it can be used for beef, that is meat purpose, and lactating dairy purpose cow. So this is very common, that is fenbendazole, because albendazole, as you know, albendazole is contraindicated in the first trimester because of some teratogenicity. So fenbendazole is the safest in pregnancy. Next is toxic effect of lincosamide in horses. Not only lincosamide, tetracycline. Tetracycline also causes enterocolitis in case of horses. So these are the toxic effect or side effect of tetracycline or lincosamide. Next is, which of the following is FDA approved drug for gastric ulcer in case of horses? So this is the proton pump inhibitor omeprazole, which is approved by the FDA for the treatment of gastric ulcer in case of horses. So omeprazole.